Welcome to the Real News Network in Baltimore. I'm Kim Brown. Two House of Representative committees on Wednesday began to debate the Republican bill to replace the Affordable Care Act, or Obamacare. The bill faces an uphill battle because a number of Republicans have already declared their opposition to it, calling it Obamacare light. Let's take a brief look at some of the opening statements that members of the House Ways and Means Committee gave.
While the Affordable Care Act, or Obamacare, has helped some, it has inflicted tremendous harm on more families, more workers, and more job creators nationwide.
This bill suffers from an identity crisis. Is this health care, or is this a tax cut bill? Does it lower costs? No. Does it bend the cost curve? No. Does it cover more Americans? No.
Incredibly, for legislation of this magnitude, this plan, the particular plan we are considering today, even its principles, has never had a single public hearing anywhere.
Since the bill was first presented to the public on Monday, doctors and other providers said that the bill would probably cause many patients to lose insurance and raise health care costs. In a letter, the American Medical Association rejected the bill and urged lawmakers to reconsider its drastic changes to Medicaid, the government health insurance program for the poor. Joining us today to take a closer look at the Republican health care plan is Dr. Jane McAlevey. Jane is the author of the book titled Raising Expectations and Raising Hell. Also, she is a contributor to The Nation and author of the new book out right now. It's titled No Shortcuts, Power and Strategy in the New Millennium. Dr. Jane, we appreciate you joining us. Thank you.
It's great to be here. Thank you.
So a gradual consensus seems to be emerging that at least one of the main consequences of the Republican health care plan is that it would lead to fewer people being insured, because replacing insurance with subsidies, or rather replacing insurance subsidies with tax credits, would make health insurance for low-income households and for the elderly too expensive. So, Jane, what do you think about this, and what do you see as the main consequence, and what other consequences do you see with this proposed Republican health care plan?
Yeah, let's just start and be very clear from the beginning. The bill is a complete disaster. There is not a single thing in the so-called repeal and replace bill that has any interest for ordinary working people in this country. The bill, for starters, is primarily a gift to the insurance industry. And other than that, it's a gift to the insurance industry and the super wealthy. So the exact numbers of how many people would fall off as a result of this legislation if they pass it, no one has the exact number, but it's pretty substantial. But there's several things happening at once here. One is, there is no question that millions of people will be thrown off of health insurance because they're going to roll back the Medicaid expansion. And Medicaid is fundamental as a sort of core pillar to the healthcare system as we understand it right now. So sometimes people think of Medicaid as a program for the poor. I have to tell you, it's really a program for our grandparents. When you think about the complex math that average people in the United States do to figure out how are they going to pay for long-term care costs when their parents are aging, a key component of that is really Medicaid and how it blends with Medicare. So the first thing is, the Republicans want to basically make it so that older Americans are going to be living, I don't know, like under bridges eating cat food. And I'm really not exaggerating about this. The bill is devastating to older folks. It actually it says that healthcare costs can rise 5 times on older folks. I mean, there's so much language that is buried in this legislation that is so crucial for folks to understand. And I'm glad that a lot of people are coming out against it, but we need way more than that. So there's several things we're doing. One is the attack on Medicaid expansion and Medicaid, which again is crucial for women, for people who have physical challenges in our country, but also particular for older folks, not just Medicare. Because Medicaid and Medicare have a really close relationship, they're sort of tied together. So that's crucial. Another thing that is really interesting that I think it has gotten some attention, of course, on the Real News Network, but it hasn't gotten enough attention in general, is what's coming next, which is this issue that they call the right. The conservatives always name things really well. The right to sell plans across state lines, which they say is a key component, like a next phase of what they want to do in the rollout of this plan. For people who haven't paid enough attention to it, and I think Dean Baker touched on it several days ago, but it's a very, very, very deep attack on the right of more progressive states to actually hold the line and keep having good state-based plans. Essentially, what the conservative Republican legislature is proposing, and to Trump, is really a state's preemption attack. They want to make it so that a health insurer can take maybe the weakest regulatory state in the country, which is probably either Alabama or Mississippi or some southern right-to-work state in this country, right, where there's low regulation. Health insurers want to be able to go into a state like that, where there's very low regulations, where ordinary working folks have much less power than states like New York or California or Massachusetts or fill in the blank. They want to be able to go to a state where there's very low regulation. They want to put forward a really deficient healthcare plan that I wouldn't even call a healthcare plan. It'll be something with very high deductibles that no ordinary working person can afford, with very high premiums that no ordinary working person can afford. They're going to call that a healthcare package. They're going to make it look like it costs less than what you might currently get under the Affordable Care Act. And then they're going to shove it down our throats because once it's in one weak regulatory state like in Alabama or Mississippi, they'll say, because they're going to do a state preemption attack, they're going to say, well, that plan is now going to be offered in the state of California or the state of New York, two states where, by the way, a bad plan simply wouldn't pass regulatory muster right now. So the veiled attack that's coming is actually really deep, and it's a preemption attack. And for a conservative movement that says that they're in favor of states' rights to be using the sort of bully pulpit of states' rights to attack our right to access good health care in a state like California, where I'm sitting right now, or New York or Massachusetts or Washington or any number of states where they have much better standards for what healthcare insurers can offer to people, it's a deadly move. And deadly meaning, I think that's not hyperbole. I think that this plan is going to result in real pain for ordinary working people in the United States of America.
We've been speaking with Dr. Jane McAlevey. She is the author of a couple of books now, Raising Expectations and Raising Hell. Also her new book that is in bookstores now. It's titled No Shortcuts, Power and Strategy in the New Millennium. We've been talking about the Republican House proposal, their new health care bill to replace Obamacare. And in part two of our conversation, we're going to talk about the prescription drug costs and whether or not Donald Trump is looking out for seniors in that aspect, and what is going to happen with Planned Parenthood in this new Republican health care proposal. So stick around for part two of our conversation. You're watching the Real News Network.